Hello everyone, welcome to MedEd. My name is Ngoya Nicholas. I'm a pharmacy practitioner. I'm glad that you are watching this video today. So I just wanted to talk about cyclooxygenase enzymes because it will be unfair for me to keep talking about the NSAIDs without giving more information regarding the COX enzyme, the cyclooxygenase enzyme, because these are the main targets for NSAIDs. Okay, so about cyclooxygenase enzymes, there are two types. There is a COX-1, that is cyclooxygenase 1, and cyclooxygenase type 2. Okay, so cyclooxygenases, they play a bigger role in the production of prostaglandins, which are compounds that are involved in inflammation, pain, and other physiological functions. Okay, the reason as to why I'm talking about these enzymes, I just want to emphasize on the importance of maybe consulting your medical or healthcare professional before using these medications, because there are those ones that are selective and there are those ones that are non-selective. Okay, most of these NSAIDs, they are non-selective, meaning they inhibit both the good enzyme and the bad enzyme. So in this regard, COX-1 is a good enzyme, okay, because it's a constitutive enzyme. It's present and active in most tissues of the body. Okay, so these are good enzyme. It's not supposed to be inhibited. That's why I'm just emphasizing on the importance of consulting your healthcare provider before using these medications, because the COX-1, it plays a very important role in the body. Okay, because just the way I mentioned, it is available, it is present in and active in most tissues of the body. So most of the part, okay, it is involved in the maintaining normal physiological function of the body, such as protecting stomach lining, okay, and also supporting kidney functions and regulating platelet aggregations, okay, and also there are also some other functions that I have not mentioned here, but just know it's a good enzyme. Okay, so it is located in most body tissues and it's active and it's very important, so note that. Okay, so when aspirin inhibits it, it can cause some serious effects on your stomach lining, kidney function, and also regulating platelets. That's why it's just good for you to go for further medical advice before using this medication. So let's look at COX-2 that is supposed to be inhibited, and sometime later in this video we'll talk about the selective and non-selective COX inhibitors, so that I may bring this knowledge to you. So let's look at COX-2. Okay, COX-2 is an inducive enzyme. That means that its expression is typically low, but it can significantly increase in inflammatory responses. So this enzyme, I mean COX-2, cyclooxygenase 2, is involved in the production of prostaglandins, which mediates inflammation, fever, and pain. So is the enzyme that is supposed to be targeted by these NSAIDs. But because most NSAIDs are non-selective, they target both COX-1 and COX-2. But COX-2 is the enzyme that is supposed to be targeted in this scenario. So this enzyme is typically found in inflamed tissues, macrophages, synovial cells, and other sites of inflammation. Okay, so you want to go and look at the differences between COX-1 and COX-2, but I've mentioned most of them above. Okay, but let's just look at the preview of the differences between these two enzymes. About the difference between COX-1 and COX-2 is that COX-1, it is involved in maintaining the normal cells function in the body, while COX-2 is majorly involved in inflammatory responses. Then another difference is that COX-1 is constitutively expressed in most body tissues, but COX-2 is inducible and is only expressed during inflammatory responses. Okay, so if you need a further explanation, I know it may be complex to some people, but that's how I can explain it. So let's look at the side effects of inhibiting both these two enzymes. Okay, just as I had explained earlier, COX-1 is a good enzyme, so it should not be inhibited. But because most of the NSAIDs, they are non-selective cyclooxygenase inhibitors, they will typically inhibit both enzymes, both the good one and the bad one. Okay, and we know COX-1 is involved in many good body functions, like just protection of the stomach lining, kidney function, and all other good functions. So if you take non-selective NSAID, it will inhibit both COX-1 and COX-2. When COX-1 is inhibited, the patient will automatically have gastrointestinal issues because of lack of protection of the stomach lining by COX-1. But COX-2, when it is inhibited, it will be a positive effect because it will just reduce pain and inflammation. Okay, so those are the side effects of inhibiting. Well, this is the end of this short video. I just wanted to explain more about cyclooxygenase and types and how they work. I hope this information has been so insightful and so helpful to you. If you need any further explanation regarding this information, please help me know and I'll be able to address it accordingly. In another video that I'll post, we'll delve into another non-selective cyclooxygenase inhibitor, that is naproxen. Stay tuned and let us meet then. Bye and thank you.